Hey everybody, welcome to the Home Care Forum podcast with your hosts, Sasha Guillaume and Amina Poricanin. A lot going on this week. We're going to hit this hard and fast. Amina, how's it going? And jump in wherever you would like, and I'll try to catch up.
I cannot wait for this week to be over. One way or another, things have to change. I've been on this single statewide FI roller coaster for 12 months now almost. I'm ready for a vacation, another one. And I'm ready for Passover. I'm
Yes.
ready for Passover. So all of that stuff, let's get going. As far as updates, there are plenty. So stick with us. Thanks for tuning in. Make sure you follow, make sure you subscribe. Tell all your friends to follow and subscribe as well. This week has been very busy. So we're recording this on a Wednesday, but this past Monday, the New York State Department of Health held a press conference to reaffirm that the CDPAP Single Statewide FI program is going into effect on April 1. And this was in response to a lot of calls for a delay. Even the union, the SCIU 1199, sent in a letter late last week asking and urging the state to postpone this, given how poorly the transition has been going. Thanks for showing up so late. I have no idea what prompted that letter. Possibly some news that the union will not be welcomed by PPL, maybe, but that was a surprise. Nonetheless, the state got on the podium on Monday and said everything is on track. They have over 100,000 consumers and PAs signed up, supposedly complete. There was a lot of backlash to that statement and the numbers. A lot of industry insiders still believe that it is a false number, that PPL and New York State continue to lie. During the conference and just before it, there was a caring majority. This nonprofit advocacy group was doing a protest. They had their own press conference that got a lot of positive coverage. A news reporter from one of the local stations actually was reporting how she herself tried to contact PPL and was unsuccessful getting through. And she was basically saying all of these advocates, what they're saying, what they're complaining about is in fact true. Based on my own experience, I never got through to anybody when I called PPL. I left a message and it's more than 24 hours later, and I have not gotten a call back. So that was interesting to see all that play out, but it didn't make a difference, right? The state is still adamant about going forward on April 1. The big news that has come out of that conference is that the state will give this 30-day grace period to those consumers and the personal assistants who are not yet enrolled with PPL. So they are trying to minimize this situation where consumers will be left without services. So what they're saying is continue getting your services. You PAs, go ahead and work. We'll just pay you 30 days later. And today, just before we signed on to start recording, the DOH issued a guidance memo explaining the conditions under which they will pay for these services, which these are largely accurate conditions, right? The personal assistant has to have work authorization paperwork, tax paperwork, wage paperwork completed, all the usual conditions precedent to having someone hired and start working. And so for a lot of personal assistants, there's no guarantee that their paperwork will be accepted, yet they're being told to work, spend time with this job with no guarantee of payment 30 days later. Moreover, it is not clear to me how the state can bypass the payment laws, the wage payment laws of New York State for home care services, which are considered manual labor. The worker needs to be paid no later than 7 days after the pay period ends. The pay period is a weekly period for these workers. And so I have no idea on what authority the state is relying to say, work for 30 days, we'll pay you 30 days later. Sasha, feedback.
Yeah, I mean, I think the ambiguity around this, it's not said, but it's what I take it as assumed, right? That this is 30 days later being paid by PPL. Not fully clear in the language, not what I saw, but I assume the contracts are being cut, the authorizations are being ended. Some contracts are being extended. Actually, I was going to bring this up later. We just got messages from some of the plans that the authorizations are ending, but they're not cutting our contract because if anything happens, they can then issue us an authorization for services, right? So if these aids work, it's ambiguous who they're going to get paid for. The plans are allowing them to work, are allowing our contracts to continue. So if they come back to us with the bill, then it falls on us, right? So there are many outs for this to happen, but I think we really need to be concerned. And I don't know how many people can survive a month of not getting paid and getting paid retro at this level of work, right? I mean, it's disheartening. It's a lot of what we thought was going to happen is going to happen 100%. And one thing that I learned this week is everything's performative. As I don't know how thick that's the sarcasm in that statement was if that came through because listen, you 11.99 too late. Yeah, you're 100% right. They started this, right? As childish as I sound, yeah, they started this. The politicians who allowed this to go through, and they're performing, holding press conferences, letters, slamming the podiums. That ridiculousness, right? Your name is on the budget from last year, and now you're performing. And the newscasters, they're performing by calling PPL on the phone. Like, where were you? And where was the high level of scrutiny needed to put pressure on the politicians to actually make them move? It's it's absurd. It's going to hurt the patients. It's going to hurt the aides. And yeah, I'm a provider. I'm an owner. It's going to hurt the owners. 100% going to hurt the owners. Like nobody expected to have this risk of, X amount of unemployment insurance to pay and whatever, outstanding reimbursements to whatever wage parity requirements you have. Then you still got to keep your lights on because we're going to talk about it later. The PMPM, what's going to happen with the retro? Maybe there's money coming. So we'll get to that. I don't know if you want to pivot to that, Amina, but it's a nightmare.
It is a mess. It really is a mess. And we do have some litigation and lobbying advocacy happening at the federal level as well. There is a possibility of CMS and Health and Human Services involvement to put a stop to the state's action, but I'm frankly not sure if it's going to come on time. There will definitely be an interruption in service and an interruption to all of these FIs businesses, right, over the next week. And if we look at the timeline, Passover starts on Thursday night from what I saw. April 1st is Tuesday. Then we have Wednesday, and then a lot of lights go off anyway because of the holidays. And then we are waiting for the budget. I don't think the budget will be done on Tuesday. So a lot really to unfold over the next few days. I am amazed at how many providers still have not communicated anything to their consumers and to personal assistants. Nothing. If you are listening to this and you are one of those providers, you need to speak to them. Okay? You need to speak to them about what happens the evening of March 31st if they are an overnight case, right? You need to send out a communication telling them you are not allowed to work on April 1. Don't try to clock in. Don't try to give me paper timesheets. You're not getting paid. Okay. And, I get these questions like, well, what if they sue me for not payment? How are they going to sue you if you've told them we are not allowed to provide these services anymore? The state has stripped us of our legal authority to provide our services. Therefore, we cannot pay you. You are not allowed to be in there in this capacity as a PA for us. If you want to do that, you need to go to PPL. Now, I've also heard that PPL is not enrolling anybody this week because of such chaos and last minute, scramble. They're not able to enroll anyone. So there may be quite a lot of people that are out of luck.
Wow, that's amazing. And there was a point by the Fiscal Policy Institute that warns of how the transition could hurt the PAs with their health insurance, right? The making it less affordable, and if that the aides are taking the minimum value or whatever essential plan, which will be $1 per hour contributed towards that, it could knock the aides off of their Medicaid. This essential plan only covers preventative. If they go to hospitals, now what? You're just going to saddle them with debt like this. This makes absolutely no sense, and I don't think that consumers will want to put that burden on their family going to PPL. And imagine a few aides start getting hospital bills or doctor's bills. It's gonna be like, hey, grandma, I can't do this anymore.
Yeah.
And you're gonna have to find somebody. So everybody's shifting. Man, yeah, it's flabbergasting. And I'm trying to seem articulate. And this is not allowing me when you think about the damage that's being done right now. So,
You're
well,
saying it
what?
right.
Yeah, yeah. So why don't we go to the PMPM, which is possibly good news, where on March 20th, the court issued ruling on both the city panties petition and DOH's motion to dismiss, where the court determined that DOH's implementation of the PMPM methodology was unlawful and denied the motion to dismiss and granting city panties petition for relief, thereby voiding the three-tiered reimbursement rate structure. So what does that mean to providers? Is there a retro reimbursement rate coming
Yeah.
up? I didn't say any details. Yeah, yeah. I mean, they just took the money back. They just took the money back like a couple of weeks ago. So I mean, come on. Like, if the methodology is wrong, why is the recoupment okay? I mean, other than okay, in the language of the contract, they're able to, but it's directly tied to this. So come on, Amina, tell me something.
Nothing helpful. I'm sorry. So the DOH comes out and says to the plans on a PowerPoint, you have to change how you reimburse the providers. So that is what the court said. If you're going to make this big of a change, you have to do it through the rulemaking process. You can't just put out some sort of a PowerPoint. And by the way, the state will probably appeal because there's millions and millions of dollars at stake here. But assuming this decision stays as is, because I actually do think that the state needs to pass things like this in a regulatory fashion and not through a PowerPoint. Assuming it stays like this, the recourse of the providers who are with MLTCs is really to sue the MLTC, because the MLTC had discretion in how it was going to implement what the DOH was telling it. They didn't have to go to this three-tier structure or these rates. Most of them did. A lot of them, I don't know if you know this, but a lot of them kept pretty decent rates for a lot of providers. They squeezed the others, but they kept good rates for some of their favored agencies. And so really this dispute is between the plans and the providers. The providers will have to sue the plans. If you recall, the plans came out, some of them at the last minute, some of them after August 1, and said, we're changing your rate. At that time, what providers should have done, and I know a lot of them did, is to say, don't take my money out, at least not until the notice period's over. It was like, in most cases, it was a 60-day notice period that they did not even do. And so the providers should, at the very least, sue for those 60 days worth of reimbursement changes. And so that math is the delta between the new rate and the old rate, possibly times any interest, right? Under the insurance prompt payment laws, because they need to pay that back. Maybe attorney's fees. And some of this will have to go through arbitration, which is not actually easy to commence or cheap to commence, through the American Health Law Association, which is the arbitral forum for healthcare disputes with plans in many cases. I have a bunch of cases there right now because I sue a lot of plans in my ordinary practice. So this is kind of a victory, but not really, because this is telling the state you shouldn't have done this. But ultimately, it was the plans who implemented it. I expect that the plans are now going to the state and saying, give us the money so we can pass it down to the providers so they don't sue us. And when the state tells them no, then they're going to turn around and say to you, no, sue us. Sue us if you want to enforce your rights to get reimbursed for the delta between the rates that we changed. But we're not giving you money just nilly-willy.
I wonder if it could be a collective action on that. I doubt we have enough for a class action kind of suit. But
That's a great point, actually. I think you may. I think you may have enough for a class action unless your contract with the MLTC contains a class action waiver.
okay, so that, I mean, that's something that we could look into, or an association, wink, wink, could look into and advocate for. And it would be great if the association would include non-members as well and show the value in their association to attract future members, maybe, right? I mean, I'd be willing to fork over a little bit of money for somebody who got me a lot of bit of money.
Mhm.
So it's just free advice to any association persons listening.
Listening, right?
Right. The last thing that I had is an update on our lawsuit for personal home care, which submitted an as filed brief in support of our emergency Supreme Court application, which will be considered by Justice Sotomayor with the hopes for an expedited referral to the court for a broader consideration in the next day or so, right? So the deadline's coming, so let's see if we get something. I'd like to go to the Supreme Court just to hear our company's name read aloud. All right, so that is it for us this week. This has been the Home Care Forum podcast with your hosts, Sasha Guillaume and Amina Poricanin. Have a good one.
Thanks, everybody.